Hi, this is Maggie, your physio, and I'm here today to talk about some exercises that are going to help you to release a little bit the tight knots that we might have in the hips, bum, and perineal area. So this is a great release for a lot of ladies that might have a little bit of urge, so they have to go to the washroom very often. The pelvic floor muscles might be a little bit on the tight side, so we call it hypertonicity. So we need to release those muscles, which sometimes a little bit harder to do from the outside, but this is a very good technique. And all you need is a ball, and it can vary from a very flexible, pliable ball to a little bit harder, or yeah, and it even has a little spike here that has some spikes on it. But you can also eventually go into a tennis ball or lacrosse ball. It all depends on how much you can tolerate, how tight and how uncomfortable those muscles are. It also depends on which surface you choose to sit on. So if you're sitting on a cushioned chair, obviously it'll be a lot easier than versus a chair that's a hard chair, right? So I'm choosing to show it to you on a step. And if you have a lot of tightness in those muscles, then you might start with a folded yoga mat on top. So you can fold it once or twice. Again, depends on how tight you are. This exercise is also good for anybody who has just excessive tightness and pain in the hips, and they find there's some deeper knots that they can't release with just regular superficial massage or the massage standing against the wall with the ball there. So you need a little bit more of that angle of the hip bending a little bit more. So flexed hip to 90 degrees or above to get deeper into those muscles. Okay, so a lot of our muscles attached to the sits bones, including the pelvic floor muscles and including the glutes. So sometimes you can really reach the glutes on the surface, but not so far deeper down. So this is a good technique if you already tried all sorts of stretches, you already tried the wall rolling or even rolling on a foam roller and it hasn't gotten you too far, or there's still that residual tightness that's just stubborn and not going away. Try this. Okay, so I'm going to show you with my red ball. Actually, I'm going to use the blue because I think there's a bigger contrast with my pants. So like I said, if you choose to sit on a surface that's a little bit harder, you might have to pick a softer ball to start. If the surface is a little softer, maybe you might be able to try a harder ball. So you have to play around with what you have. And then just add extra cushioning if you need to. Okay, so we have the two sits bones. So if you're sitting up tall, they're the ones that you're resting yourself on. So if you have a lot of padding there, you won't be able to feel it as much, but you can still, if you're sitting up aligned, that's where you should be sitting. So if we lean a little bit further back, if you're slouching, then we're going more towards the tailbone. So you want to stay away from the tailbone. But for our exercises, you will be leaning a little bit towards that because you want to get the quadrants on the back part of the sits bones, on the front part of the sits bones, on the outside of the sits bones, and on the inside of the sits bones, okay? So think of those two bones sticking down, and then you're trying to massage everything that goes around that sitting bone. So you're not really putting pressure on the sit bone other than just sitting on them, but the ball is going to be going around. So you're going to have to find which spot around that sit bone is really uncomfortable, okay? So I'm going to show you on the side here. So sits bone right there, okay? So it's pretty much in line with the middle of your pelvic bone here. And then you're going to go ahead and put that ball slightly behind that sits bone. So if you go and roll onto that ball and you start, okay, I hit the bone, we went too far. So go a little bit behind that bone. And then you can stay there and either breathe through it for about 30 seconds and you can put a little bit more weight. So I like the bench because I can kind of gauge how much pressure I put on it. So even if I have a very hard ball, I can still gauge how much pressure I can put on it. So if I don't have anything to hold on, I have to really try to focus on my breath to try to release that muscle. Relax the muscles in the bum and try to sit there for about 30 seconds. Deep breath in, deep breath out. Every time you breathe out, maybe try to pull in your pelvic floor muscles a little bit, and that will help to loosen up a little bit that spot. So you did your 30 seconds there. You're going to move out to the outside of that sits bone. So find that other spot. And again, nice and tall, Breathe in, breathe out. Some like to do a little bit of wiggling of the legs there, so it's fine as long as you're not feeling you tensing up because of it. When we tense up, we hold our breath, and we're also not allowing that blood flow and that muscle to contract and relax, right? So we want to really try to relax through that. 30 seconds, okay, that was fine. And then I'm going to go towards the front part of that sit bone. So basically between your sit bone and your pubic bone. So these are all parts of your pelvic bone. And then again, if there is really no discomfort, or you don't find that there is an actual uncomfortable spot or tightness, then you can move on to the next one, right? Because we will have the different quadrants that will be a little bit tighter. And finally, you go towards the inside of that sit bone. So you basically getting close to that perineal area, and that's okay. Again, as long as you can breathe through it. You might even be sitting right between the two sits bones with that ball. As long as you're comfortable, as long as you can breathe through it, take your time there. If there is any chance that the muscle is tight, you're going to spend a good amount there breathing to try to relax. And you'll feel that after a few seconds, it will start letting go if you're allowing yourself to relax. Okay, and then you do the same on the other side. Some women like to do it both sides at the same time, so it just depends if you have the balls proper for that, or if you have a wider seat. Like I like the bench because of this, right? So the step here, I can work on both sides at the same time. And obviously it doesn't matter if it's a lower seat or a higher seat. So if you have a higher seat, it might be even more comfortable for you to do it. We can go a little deeper if it has a bigger degree of bending here, right? Because then we can get those deeper layers that sometimes we can't get if we're doing any sort of release in standing against the wall, or even on the floor. Sometimes I find if you're lying down and you can't really reach that spot, right? So most of the muscles that we're dealing with are the ones in the back. So if you're rolling your glutes, it's really harder to get to that lower part, okay? So those would be the options, and hopefully they'll help you to release some of the tightness in that area. And it's also great for if you have a lot of tension in your lower back. So again, the glutes will go all the way down towards that sitting bone. So it should help you. If you have any questions, let me know, and hopefully they'll help you. Bye-bye.